the Africa CDC says apart from South Africa, the Delta variant has also been reported in countries like Uganda and the Democratic Republic of the Congo, where it's driving the current third wave. The Africa Center for Disease Control also says the continent has recorded a 39% spike in COVID-19 cases, which is more than any other region in the world in the past week. According to Dr. John Kingasong, the number of deaths has also surged by 38%. He also warned that the numbers point to a devastating third wave. Currently, South Africa leads with infections. The Southern African region is the worst affected, with 40% of recorded cases since the first case was reported last year. We are now joined by Dr. Gitahi Githinji, Group CEO, AMREF, and also a board member of the Africa CDC. Doctor, welcome to Africa Live. Dr. Gitahi, you recently tweeted about Africa's fourth wave and its faster acceleration rate. Can you give us more details on this?
Yeah, hi, thanks for having me. So we would say actually the third wave for Africa, but fourth wave for some of the countries, like, that were ahead of others. So, but generally, when you look at the aggregate numbers, Africa is going through a fast accelerating third wave. And I think if you just look at the numbers, you'll see that if you look at the second wave, it took around 1 month to move from 15,000 cases a day on a moving average to 25,000 cases a day on a moving average. Now it's taken exactly half that time, 2 weeks, to move from 15,000 moving average to 25,000 moving average. So it is much faster in acceleration, and we expect it's going to peak at a much higher point than the last wave. We peaked around 32,000 cases a day. This is going to go much higher. That's what is expected.
Well, those are startling statistics indeed. Doctor, experts are saying that the peak of the third wave of COVID-19 will likely be higher than the second. Why is that?
It is so because, if you look at the previous two waves across the continent, the first one was much lower, the second one was higher. This third one is moving much faster, and I don't think we expect anything less. We expect that because there has been no vaccination intervention that is of any scale. We expect, therefore, that the virus is freely spreading from person to person. It's going to be higher. Secondly, we expect that new variants are playing a role in the accelerated transmission, and that may as well be the Delta variant. There's not a very robust genomic sequencing, but we know for those countries that have genomic sequencing data, the Delta variant is present and driving the start.
Oh, well, Doctor, thank you for mentioning the variants. Could you tell us more about these variants that are showing up in various African countries?
Well, I think when we talk about variants, we must remember that this virus, like any other virus, actually does create errors in its replication. So the virus is replicating to propagate itself, and in that rapid propagation of the virus, it creates errors. Those errors are the ones we call mutations. And when those mutations change the way the virus behaves, then they become mutations or variants of concern. And that especially would be, especially in 4 areas. One, does it increase the infectiousness of the virus? We have seen that the Delta variant is actually more infectious and more transmissible than the previous variants. Secondly, does it affect the severity of the disease, how the virus causes the disease? There are some claims in some quarters that actually people with the Delta variant are sicker than people from previous variants. The third thing is whether it actually does escape vaccination. And there is data that shows that it reduces the efficacy of the existing vaccines, not significantly, but warriors for any future mutations or future changes. So the vaccines we have now are working, but we are seeing that there could be some slightly less efficacy. And finally, how it's diagnosed. And there are reports, also scientific reports, that claim that this new Delta variant may also escape the typical gold standard test, which is what we call the PCR test. And therefore, do we need to develop new tests for it? That's actually out there in the laboratory now, and scientists are looking around it. But for now, we still continue with the tests we've been using.
All right, significant statements that you've made there, Doctor. Now, even with all the warnings, some countries in Africa don't seem to be very keen in enforcing preventative measures. What is the likely cost of this laxity? Or can we just say that Africa is unlikely to be impacted the way other regions have, Doctor?
Starting with your last statement, it is clear that Africa is not going to escape like we have, many people said earlier, Africa is going to escape, obviously because Africa did not accelerate as fast as the rest of the regions of the world. But we must remember that there are several factors that resulted to Africa being a late comer, so to say, in the surge and in the increase of infections and deaths. And this has to do with this mobility. A lot of African people don't move a lot. And if you think of the continent of Africa, movement from one corner of Tunis to the other corner of Cape Town doesn't happen. It's rare that happens because there's no connecting railways. So people move within their countries, and even within those countries, the mobility index or the movement index is very low. So it takes long for the virus to spread and find a hook. And that's why Africa is coming later than other regions. So it's no escape. It is that Africa is facing catastrophe, just like other regions. But we are lucky that we can actually avoid that catastrophe by vaccinating people, because the other regions do not have vaccines to use, but Africa can access vaccines. If we can resolve the vaccine access, then we may avoid the catastrophe. But there's no escape for Africa. And the problem that we are having with that we are raising of countries not taking the measures necessary, it is a mix of things. Some countries, it's a political decision. We saw what happened in Tanzania, completely unfortunate. But now we've seen the government turn around and say, please take care of yourself. But even within countries, government have measures and policies. But that, for the people to see, who are having to make a daily livelihood by going to the construction site, they have to continue working to eat. So this is actually the complexity. So government has to also now increase the capacity of the health system, because they know that the measures are not going to have 100% compliance because of the state of the economy.
All right, Doctor, finally, you briefly mentioned vaccines. As much as Africa is demanding vaccines, many countries are yet to use the stockpile initially provided. What's your take on that?
My take is that there is no one-size-fits-all. And we know that there are many countries in Africa that have vaccinated up to 100% or used 100% of the vaccines they receive. There are countries that are at a 50% mark and below, and those should be the concern. But overall, we know there are countries that are rapidly taking vaccination, and their biggest constraint is availability. So number one is that we shouldn't look at Africa as a continent that's not absorbing vaccines. We should look at country by country. Secondly is, those countries that are not absorbing vaccines, why are they not absorbing vaccines? It's a mix of many things. For some, it's summarized as hesitancy, but that's actually not the key problem. The key problem is logistical capacity. Many countries like DR Congo, they are vast geography without a proper system of distribution of vaccines. That's number one. Number two is that people are being required to leave their homes to go for the vaccine. Previous vaccine rollouts have actually depended on campaigns like polio campaigns, polio vaccine campaigns, where health workers, community health workers go out to the people. But now we're expecting people to drop what they're doing, to come for a vaccine they're not aware of. There's no, right communication. Governments are not spending a lot of money actually going on radio and going on the ground with community health workers, religious leaders. So it is a logistical issue. So this hesitancy is also not absolute. It's not a no. It is that, can I hear more? So there needs to be engagement, and we need to look at Africa as a continent that is ready, willing to vaccinate its people to avoid the catastrophe of COVID-19. We need to split it to countries that are accelerating and then resolve the issues for those that are having challenges of rollout. But most importantly, where are the vaccines? Africa needs the vaccine.